The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to a Wealthier and Healthier Tax Time. This is a Rufus Refresher webinar put on by the Aspen Institute Community Strategies Group with support from the Annie E. Casey Foundation. My name is Travis Green and I'm a program associate here at the Aspen Institute. We coordinate the Rufus Action Network, and Rufus stands for Rural Family Economic Success Action Network. I just want to make sure that everybody's able to hear me. Can people type in some questions or some chat comments just to make sure that audio is working for folks? Great. Great. It's good to know that. So to jump right in, we have an hour and a half here. We have a lot of material to go through. We'll get started right now. So since 2009, we've been offering these topical webinars to practitioners to help working low-income rural families do better. These webinars are open to alumni of the Rufus programs and their colleagues and friends, and we are also excited to welcome people to the call today that are specifically interested in tax prep and tax outreach, and its cross with the Affordable Care Act this tax season. And so you know, we are recording today's event. Videos from today's webinar will be available at the end of the week or early next week on our website, rufus.org. The team that put today's event together is very excited about today's topic. The opportunity to help low-income rural families because of this rare overlap in these two critical programs is unprecedented. And on today's webinar, we look forward to sharing why. We will start with a brief overview of the Rufus framework, the framework that brought us together today. Next, we'll do a quick overview of the earned income and child tax credits. After that, we'll cover the basics of the Affordable Care Act and why it relates to EITC and CTC this year. That's Earned Income Tax Credit and Child Tax Credits. And we will conclude with a remarkable story from Central Texas where an organization is already doing this, putting the two together. Janet Topolsky, the director of the Aspen Institute Community Strategies Group, will provide the EITC CTC introduction and moderate today's discussions. Tara Straw from the Center on Budget and Policy Priorities will introduce the Affordable Care Act and its relationship with EITC, CTC. And Elizabeth Colvin will share her experience from combining tax prep and ACA in Central Texas. A quick word about technical details. Everybody is muted. If you have clarifying questions during the presentations, go ahead and type them into that questions box that you used to let me know that you could hear. We're also encouraging you to tweet about today's event. We have almost 100 folks registered for today's webinar, but we anticipate that there are thousands more that likely have the same questions. So if you go ahead and tweet them using the hashtag Rural Families or note us in the message at AspenCSG, we'll make sure that those tweets are answered on today's webinar and that they're also, we respond to the tweets so that others can find the answers as well. If you are having technical issues, go ahead and email csg@aspeninst.org, and my colleague Kristen Firerobin will try to help you troubleshoot your connection issues. You can also use your question box to ask some questions, and we can try to address those as well. Before we start, I have 4 questions that I wanted to ask everyone so that we can know who's on the call. So on your screen, you will see 4 questions, and we'll invite you to respond to those. So 1 second while I pull those up. So the first question, does your organization conduct an EITC-CTC outreach campaign? And this is not just Vita. If you do any kind of outreach around EITC-CTC, go ahead and let us know. And if you are a national organization that doesn't do direct service like the IRS, for instance, go ahead and put NA. Great. Okay, 1 more second on that. this was the results. 56% of you have an established outreach program. Great. Next, does your organization operate or through a partnership operate a Vita tax site or tax sites? And because we're a rural program, virtual tax sites count as well. One more second on that. Okay, this was the result. Next. Does your organization assist families in enrolling in other benefits that are not EITC, CTC, or health insurance? Any other kinds of benefits? Okay, one more second on this. And we see that a lot of the organizations currently do not offer other benefits at their tax sites or in general. And finally, does your organization assist families in enrolling in health insurance? That can be Medicaid, Medicare, or are you currently helping people get into the ACA exchanges? One more second. And it looks like currently not a lot of you are assisting people in health insurance, and so this is a great phone call for you to be on. We'll provide a lot of information about that. So to continue, today's webinar is based on the Rufus framework, which is based on 3 family focus goals: earn it, keep it, and grow it. Helping families earn a better living, keep more of what they earn, and grow what they keep into assets over time. Today's focus goals for today's conversations are going to be keep it 2, 5, and 6, which directly relate to tax preparation outreach campaigns. And then we're also doing affordable health insurance campaigns, and that includes Earn It 8, Keep It 7, and Keep It 8. So these goals, along with all other Rufus goals, are available at rufus.org, and you can look through those goals and find action ideas that relate to them. But first, I'm going to go ahead and pass it over to my colleague, Janet Topolsky, who's the director of the Aspen Institute Community Strategies Group, to talk a bit about EITC, CTC, and why they're a critical tool for low-income working families that are trying to get ahead. So, Janet, are you there?
I am indeed, and thank you, Travis. While you're transferring the comm to me here, I just want to note that somebody has already typed in a question. In fact, Barb Wolin typed in the question, will the webinar be available to others via recording after today? And the answer is absolutely yes. And it'll be on the rufus.org website, but also Travis will be sending an email, or CSU will be sending an email to everybody who registered for the webinar that gives you the link when it's available, so you can share it with your friends, family, and loved ones. I am here to quickly just give you the basics on the Earned Income Tax Credit and the Child Tax Credit, and then to moderate us through the rest of this webinar. And thank you all for joining us today. I mean, the fact that we found out that of the people who are on the webinar so far, 22% of you don't even do EITC outreach yet, tells us that we always want to give you just a little bit of the basics on what these are for any newcomers. So for those of you who are old hands, just stick with us for a few minutes here. The Earned Income Tax Credit and the Child Tax Credit are two refundable tax credits that are available for people who are working but who don't earn a lot of money, basically. And what the EITC and the CTC do is help make those families, help them make ends meet. And a lot of people think of EITC as connected to certain kinds of politics or administrations, and the truth is it's been supported bipartisanly for years now, since 1975, and it was actually created under the Ford administration. And has been renewed, as this says to you, or expanded with a lot of bipartisan support throughout. It is, unlike a lot of people talk about, oh, there's Wealthier and there's TANF, there are all these big programs to fight poverty in the United States. Actually, the largest, most effective poverty-fighting program in the United States is the Earned Income Tax Credit coupled with the Child Tax Credit. As we said, it helps these families make ends meet their basic needs. But what a lot of people don't understand is it has a lot of economic development implications. And why is that the case? Because low-income people, more than almost anybody else, tend to spend their money locally. So when your local families, especially in low-income communities and rural communities, when they get the benefit of receiving whatever it is, the hundreds to thousands of dollars in their refundable tax credit, they tend to spend it locally, which means that local businesses do better as well. And so it's really actually, in rural places especially, an underutilized rural community development opportunity to get as many people as possible to claim the Earned Income Tax Credit and the Child Tax Credit. So why is it so important to talk about it here, to increase awareness about EITC and CTC? It's because even now, after really close to decades now of increasing awareness about this and trying to make sure everyone who qualifies for it collects it, it's estimated that only 4 out of 5 individuals who qualify for the Earned Income Tax Credit actually claim it. And the source of that is the IRS itself, and we trust them, so we know it must be true. Now, why are we talking about it here? Our friends at the Center on Budget and Policy Priorities, who we'll hear from Tara Straw from there a little later in this webinar, they produce a lot of data on this, and they last year did an analysis of 2011 claiming of EITC and CTC among families across America. And they estimated that 1.4 million rural Americans, including 700,000 children, were able to live above the poverty line in 2011 because they claimed the EITC and CTC. That's why it's important for rural family economic success. But billions are still left unclaimed. As I mentioned just a few minutes ago, it's not just the families who are hurt from that, it's the communities where those families are not spending those credit dollars. And the other thing is that the more families have, the more they claim these credits, the less they are likely to depend on other government programs, which means it can also save other taxpayer money, which a lot of people care about. And why don't people apply? You know, you can go to any tax credit program, and many of you who run them, 76% of you who had some kind of Vita program, know this. Some people don't file their taxes. Some still don't know about these 2 tax credits. Some are afraid to come in to file taxes because they're afraid they're going to owe something. There are language barriers. There are also sort of confidentiality barriers, especially in rural places. That's not on the slide, but a lot of people don't want to go to somebody local to talk about their money. So in rural places, a lot of people may not file taxes because they need help, but they don't want to go to someone local for help. So in that case, sometimes it can be helpful to have awareness campaigns that encourage people to go to neighboring communities where people don't know them and they don't mind talking about their money. But also, families might be afraid that they may lose eligibility for other benefits. Now, these are the current sort of numbers on claiming EITC. This isn't CTC, just EITC. So for 2013, you can claim EITC if both your earned income and your adjusted gross income are less than the following amounts, the amounts you see on this slide, for these size of families. So the most you can make is $51,567 if you're married filing jointly with 3 children, and the lowest amount, and it's quite often surprising to a lot of people, you don't have to, you can be a single person with no children and still qualify for EITC, and the income amount on that is $14,340, as you can see in this first set of bullets. The maximum credit that you can get in tax year 2013 is $6,044, and with no qualifying children, the least is $487. Another important thing to note is this is tax credit for people who are earning money. They are working, so it rewards working. You can also, but you do have to count investment income, and if your investment income is more than $3,300 a year, you cannot collect the EITC. Changes for this year, there aren't really many changes as much as the fact that some benefits that were passed in earlier years have now been extended. The Taxpayer Relief Act of 2012 extended some benefits that were approved in 2009 and extended them through 2017. The first one here was, it used to be that only families with 2 children could, if you had 3 children, you couldn't collect more for a 3rd child, and in 2009 it was allowed to get a credit of up to $655 more if you had 3 children, and that has been extended through 2017. These other 2 bullets here on reducing the sort of marriage penalty was extended through 2017, and also CTC had increased from $500 to $1,000 per child, and made partly refundable. That's also been extended through 2017. So how can you help? Many of you, as we said as we learned in the poll, already have tax assistance campaigns or awareness campaigns. There are lots of resources that are now available, easily available on the web, from organizations that have tools, that have campaign materials you can adapt locally. And right here we have on this slide the National Community Tax Coalition. Rural Dynamics in Montana has actually a great set of materials that are sort of more tailored to rural. The EITC platform, which was created by one of our partner organizations here at the Aspen Institute, the Economic Opportunities Program. Lake and Prairie's Community Action in Minnesota is another one that has done a great job on tax prep programs and awareness programs up in Minnesota. And of course the Center on Budget and Policy Priorities, and strangely enough, the IRS itself is really helpful on helping set up and helping train tax preparers, so they should in many cases be your first stop. So that's the simple overview of EITC and CTC. If you want more on that, you can go to rufus.org, because we have a lot more information on there and links for you to find up-to-date information on EITC and CTC. So before we move on to our 2 presenters, any quick questions? Seeing none, I'm going to remind you that as we go forward, you can type questions into the question box, and I will be monitoring them personally, and I will jump in if Tara or Elizabeth, as we go forward, are saying something and you don't quite get it and it needs clarification. Don't wait until the end and get frustrated. Type a question in, and then I will jump in and I will offer them the question while they're talking. So I want to turn now to our first presenter, who is Tara Straw. Tara Straw is a senior policy analyst at the Center on Budget and Policy Priorities. The Center on Budget Policy and Priorities, for those of you who don't know, is a national organization that has been working tirelessly for years on budget and priority issues at the state and federal level related to policy that affects low-income people and poverty-fighting policy in the United States. Tara herself works daily on issues related to implementation of the Affordable Care Act. Before she joined the center, she was the legislative and policy director for health care for America Now, so she knows a little bit about health care. And she led a broad coalition of advocates there that worked on the passage and the implementation of the Act, so she knows a little bit about the Act as well. She also was the Federal Affairs Manager for a Physician Specialty Organization. She worked on federal and state Medicaid issues at the March of Dimes, and she was, in a prior lifetime, a policy analyst at the National Conference of State Legislatures. In her spare time, this is the most impressive thing to me, Tara volunteers at the Vita site in the Washington, D.C. area. So I want to turn it over to Tara and thank her very much for joining us. And she is going to lay out the connection between the Affordable Care Act and taxes. Please join us, Tara.
Great, thank you very much. I think we need to get the slides transferred over to me. And while we do that, I'll say that I, in addition to managing a Vita site in DC, I also do the training for new volunteers. So I have some understanding of how difficult it can be to explain some of these very complicated issues. Travis, slides?
You should have control now. Are you able to?
No.
Go ahead and try now.
There we go. All right. So let's dig in. I have a lot of information here, and I don't want to overwhelm you with it, but I know that you'll have the slides and can maybe digest it on a second helping. But health insurance is really critical in the overall ability of a family to, sort of pay its bills year to year. It's really critical to financial stability. And I have some of the numbers on the screen here about medical bills being the leading cause of bankruptcy. And you can see that millions of families with medical bills will be contacted by collections agencies, receive a lower credit ratings, they're going to empty their savings accounts, and they might even get to a point where they cannot afford to pay for basic necessities because they've got these outstanding medical bills that they're trying to cover. And obviously people who are uninsured have higher medical bills than those who are insured. People who are uninsured also suffer some other health consequences by postponing care or going without needed care, which can just make the care they receive later even more expensive and possibly less effective. People in rural areas have a particular need for coverage options. And that's because people in rural areas are less likely than people in urban areas to be offered insurance at work. And of course, work-based insurance is really the foundation of our healthcare system, because that's where the majority of us will get our coverage. People in rural areas are also more likely to be self-employed, which means that they don't have an employer who's going to deliver that kind of service to them. They need to go get it themselves, and it's very expensive. People in rural areas are also more likely to have lower incomes. And so you can see that there are 2 in 5 low-income adults in rural areas lack health coverage. And that's really what we are trying to address. And address that in 2 main ways in which the ACA, the Affordable Care Act, helps deliver new coverage to people. First is a Medicaid expansion, and that's for individuals up to a certain level of poverty. I have FPL there, that's federal poverty level, and you'll notice that healthcare people like to put things in terms of FPL. It's old habit, and it doesn't always make much sense to the tax folks, but that is 133% FPL. I think for a single person, I think that's about $17,000 if I'm not mistaken. And states are deciding whether or not they want to expand coverage. Right now, about half of states have taken the Medicaid expansion. It's actually free to them for a couple of years, and then at no point would a state pay more than 10% of the cost of the expansion, but still a lot of states, and particularly a lot of states with a lot of rural folks, are bulking. But despite that, we expect that 13 million newly eligible people will be enrolled by 2023. For people who have income that is higher than 133% of FPL, there is a second option, and that is premium tax credits. And these are available through the Health Insurance Marketplace, which is right now it's a troubled website, but it will be a much better website in the coming days. And the whole point of this marketplace is to set up state-by-state places to go shop for insurance that's available in your state. And there is assistance that's available in person, by phone, via the website, and a chat feature to help people get enrolled in insurance. And this is available in every state, whether the state likes it or not. And we expect that 19 million people are going to use this service and the APTC, which is the Advanced Premium Tax Credit, by 2023. So this chart shows you a little bit about how critical it is for tax sites to be involved. You can see right now we're in an open enrollment period. So this is the time when everyone can jump into private health insurance. And that this year there is substantial overlap with the tax season. And so there's a real opportunity to screen people as they come in to see you to say, oh, and do you have health insurance? And then if they don't, they could be sort of evaluated for what kinds of options that they have open to them. And this is really important to do the hand-holding because you know, people are very very worried and very confused by the new system, and frankly by health insurance in general. Health insurance has never been a pleasant thing to purchase. If you have been in the employer-sponsored market, then you've been really insulated from some of the more difficult arrangements that insurance companies have made. But if you were trying to purchase individual coverage, what you would have found is that you would be asked a lot of personal questions about your healthcare history. And what the law does is it sort of puts all of those to rest. But people are still having negative feelings, which no doubt have increased by the problems that they've been having with the website. And so it's really important that people get assistance to help them get through the process. So in summary, here are the things that I think it's really important to tell people when you have that chance to have them in front of you and to help them understand the really core elements of the law. So first of all, that there are new opportunities for health coverage. Really important that they know that. That there's Medicaid, but also there's subsidized private health insurance. And then I think it's a great opportunity to assist with enrollment, but there is, if that's not possible, the opportunity to refer people for elsewhere to help them get enrolled. It's also important to let people. Yes.
Tara, could I interrupt you for a minute?
Yeah.
We have someone who's having trouble hearing. If you can raise your microphone volume a little more.
Okay.
I don't know if you can do that, but if you can, go ahead and
I will try.
Thanks.
It's also important to tell people that there's a new requirement for them to have health insurance coverage. This is a new thing in 2014. And if they don't have health insurance coverage, they're going to face a penalty. So it's important to use this next tax season as an opportunity to inform people of their obligations for the year of 2014, because when you see them the following year, you may be the one who has to assess their penalty for not having insurance, so you want to make sure to give them a heads up. It's really, there's a lot of intersect between what Vita does and the enrollment process. So first of all, people who are in the Vita income range are going to see the biggest subsidies. The average exchange subsidy will be $7,900, which is a very rich subsidy for the purchase of health insurance. Also, the program uses tax definitions of household and income, and so people who already work in the tax field are uniquely qualified to help people navigate the applications. The most difficult questions that people are facing right now have to do with these things that tax preparers are already expert in. There's also a sense of trust with private information. And you should be aware that paid preparers are going to be doing a lot of this work, and so we certainly, we've worked hard to help people save money by going to volunteer preparers. We don't want to send them back to the paid preparers in order to get their healthcare situation straightened out. But also, because some of these elements are going to be on the return, for the 2014 tax year that we'll be seeing in tax sites in early 2015, it's important to get started now to understand what the law means. There are a couple of things that organizations can do. You can become a certified application counselor, and Elizabeth is going to talk more about that in a minute. You can also provide some informal application assistance, so just helping people through when they get stuck. You can also, if you know people in your area who are doing healthcare assistance, you can offer to help them because you have the tax expertise. You can take a look at what clients have had done elsewhere as far as their healthcare enrollment to make sure that they understand what they've enrolled in. And you can also do a really good screening to make sure that people either have insurance or know how to get it.
So Tara, could you
Yes.
back up just a minute because we've got a couple questions.
Yes.
And Sandra Starn, I don't know if it's Starnes or Starnes asked, what do tax volunteers have to do in order to advise clients on the Affordable Care Act? Do they have to pass a test? And I think you're saying on this slide that you can do some informal stuff just by what you read and know, but you also can become a certified counselor. Is that the correct answer there?
Yes, that's true. So there is a way to become certified, which is a great idea, and there's an online training that takes roughly 5 hours. We're also going to be developing training materials to help supplement that. Elizabeth has some of those as well. And so there are opportunities to learn more, but there's also nothing stopping you from sitting down with someone who just asked some questions, particularly when those questions are already in the tax expertise area, like questions about who do I include on the application, or what income do I include.
And Gail Lorimer also asked, is it appropriate that Vita sites offer, I think she means insurance advice without completely understanding health insurance?
Well, remember, we're not necessarily talking about insurance advice. We could be talking about assistance in completing the beginning part of the application, which is not necessarily selecting an insurance plan. Mm-hmm. And so even if you can help someone get through the part of the application that is saying, who lives in your household? By household, we mean who are you going to be filing your taxes with in 2014? And what's your income? And by income, we mean what is your adjusted gross income, which, of course, tax preparers understand. That's line 37. And so those sorts of things don't require insurance expertise. Of course, we wouldn't want anyone to do more than they feel comfortable with, and so part of it depends on your own level of knowledge. But getting consumers through that portion of it alone is really what it takes to get them to the point where they have a menu of options of insurance plans. And maybe that would be the point where if you don't have more knowledge, you step back and say, all right, here are your options. You choose, or you can contact this other group and they can help you, understand those. But the beginning part of income and household are really important and really difficult, and it's really needed assistance.
And it's only the certified application counselor who can actually enroll them in plans or help them enroll?
No, there are a group of navigators, which is a separate title but the same function. And as I said, anyone who is sort of sitting down with someone, people can enroll themselves. You can go to the website and enroll yourself. It's just a matter of, is there someone who can give you a helping hand on some of the questions? But people can certainly enroll themselves, and so it might be that they just have a couple of questions that you can help them with to help them complete the process for themselves.
Okay, and we're going to talk later about where people can apply to become a certified application counselor, I think. And so we have a lot of questions about that. One final one I want to get dispelled right now is Barb Woolen wrote again saying, a librarian told me it was illegal to help folks with health insurance applications if you're not a certified application counselor. Is that true?
No, that's not true. In fact, there are a lot of librarians that are doing it.
Right. So that Barb, go back to that librarian and correct him or her. Okay. Now we'll go forward. There are more questions. I just want you to know I see all your questions. I'm going to pose them at the right moment. Keep going.
All right. So we're gonna race through here, but this gives you an idea of where Medicaid eligibility is now. So you can see a lot varies based on what bucket you fall into, with people without dependent children often being eligible for no health insurance. And the intent of the Medicaid expansion is to even all of that out. And then above that, between 100 and 400% of the poverty level, to have tax credits to help make insurance more affordable. But then you can see in some states that have an expanded Medicaid, there's going to be a gap between where Medicaid ends and where the premium tax credits begin. And so that's going to be a problem in some states, explaining to consumers why they don't make enough, they don't earn enough to get assistance with their health care. And that's unfortunately a result of state decisions not to expand Medicaid. So as we said, individuals will have to have insurance, health insurance coverage for the year of 2014, or will pay a tax penalty. Most coverage that you have is going to cover the mandate. It's not meant to be a trick. Just about anything will do as long as you have something. And for some people who can't afford coverage, there will be exemptions. And I have listed here for your reference some of the exemptions that people will see. I'll just point out a couple. Hardship, having insurance that is unaffordable, or a state that doesn't expand their Medicaid program, those are reasons, or those are causes for exemption. Also, if someone has income below the filing threshold, they are exempt from a penalty for not having health insurance, or if they just have a short gap in coverage. Okay, so let's talk about some of the basics on the premium tax credit in the time that we have left. So I have clarified here for you the translation between poverty level and real dollars, because we know tax people respond in real dollars. So you have to have income within that range in order to qualify. You can't be eligible for any other program. And so the premium tax credit is really a gap filler in a lot of ways. So it's for people who don't have access to employer coverage. Most employer coverage counts. Who don't have Medicare or Medicaid or other kinds of public coverage. In order to get the premium tax credit, you will have to file a return for that year. So if you want a premium tax credit in 2014, you're going to have to file a tax return for 2014. And you can't be married filing separately, which, if you're familiar with taxes, you know that that's the case for a lot of things, including the Earned Income Tax Credit. So we're not going to talk about this in detail, but the credit amount is based on two big factors, and that's the amount that you can pay based on your income and the cost of what's called a benchmark plan, which is a plan that's decent. It's not the best plan that's offered in your state, but it's not the worst. But the government basically has to peg the credit on something, and so they pick this benchmark plan, which is going to be determined by your marketplace. And this, for your reference, is just showing that the more income you have, the bigger percentage of your income you would be that would be considered affordable to you, and you would be expected to pay in premiums. But again, we're not going to do the math, and so just know that that's a statutory formula. But I just want you to get the concept of it. And so we're going to look at a couple of examples just to show how this works. So let's say we have a young guy, 24 years old. His income is about $23,000. Now, in Medicaid terms or in healthcare terms, that puts him at 200% of the federal poverty level. At that percentage, the share of income he's expected to contribute is 6.3%, and that was just based on that graph. That's statutory. That's not even math. They just spit that number out at you. And that means that that is equivalent to $1,448 for him. And the premium tax credit acts as a gap filler. So there's the amount that he can pay, which is $1,448, but his plan costs over $3,000. And so the premium tax credit steps in to pay the difference between what his plan costs and what he can actually afford to pay. And that also works. So you can see that it's flexible. So if you have less income, less ability to pay, then your premium tax credit goes up, because it's filling the gap between what you can pay and what your plan costs. And there's a special provision for people, or there's special assistance for people who are older, because John, if he ages and turns, let's call him 64, his premium's going to be a lot higher because his medical expenses are higher, and insurers can charge up to 3 times as much for someone who has who is older. And so again, the premium tax credit is a gap filler. John's income is the same. We'll have him at $23,000. His income is the same whether he's 24 or 64, but his premium cost is much higher. So as his premium cost goes up, then his premium tax credit goes up. That's why this is such a rich credit. It's also why something like determining someone's income in a really accurate way is a really key to what kind of insurance that they can get and what kind of premium tax credit they can get. Just very briefly, all of these numbers, the income numbers are all based on estimates. So it's a projection of what your income is going to be in 2014, which is really kind of a difficult way to do it. But then at the end of the year, it's reconciled with your actual income. So we're basically guesstimating for 2014 right now to say what we think someone is going to earn or what someone thinks they will earn. And then at the end of the year, they're going to reconcile it. And if their income is higher than what they projected, they may have to repay a part of their credit. But if their income is lower than what they projected, they might actually get more credit. They might actually get a refund at tax time. And I'll show you here this table. It's a lot to digest, but what you can see is that the amount that someone could actually be asked to repay is limited. So the top line, I think, is the most important, which is that people under 200% of poverty, which is really who we're dealing with a lot of the times in Vita, for a single person, that's $23,000. The most they would have to repay is $300 if they receive too much credit. So there are important caps there to make sure that the risk isn't too high, so we can encourage people to actually use this credit that they're eligible for. And I think that's it. So this is just a reminder of what what I think the key points are for clients and Vita sites.
Okay, let me just get to a couple more questions here. There were a lot of questions about the certified application counselor and whether they're actually enrolling people in the plans. And I think I even have answers from people in here. There's a woman named Joyce Lash who's been sending a lot of information about certified application counselors and mentioning that really you can't, if you're a certified application counselor, and correct me if I'm wrong, Tara, you can't sort of make recommendations. What you're really doing is helping them through the process and advising them, but you can't say, I would choose this plan, correct?
Yes, that's exactly right. You're not selling them an insurance plan. The most you can do as a certified application counselor would be to say, here are pluses and minuses. Here are things to look for. Like, for instance, you might have a conversation with someone where they say, you know, the most important thing to me is a low premium. And you can say, well, all right, so here's a list of plans with a low premium. What are other things that are important to you? So you can help sort of, you know, help people figure out what their priorities are, but you wouldn't say, okay, Blue Cross Blue Shield plan number 14A is the one for you. That wouldn't be the CAC's role. That's an individual's decision.
And can anyone be a certified application counselor? So I've heard 3 different terms. So if you could sort these out for us, it would be helpful. There are certified application counselors, there are navigators, and then there are these things called champions of coverage. Mm-hmm. Can you tell us the difference between those things and what it takes to be each?
Sure. Champions of coverage, that's sort of a promotional role. So that's not really having to do with enrollment. So we'll set that aside. Certified application counselors are people who are trained and take a test to help people sort through their insurance options in the ways that we've talked about. And as we said, it's a roughly 5-hour exam, or not a 5-hour exam, a 5-hour training plus exam. And in order, so what happens is an organization becomes a CAC organization, which Elizabeth has gone through that process, so she can speak to this. And then each individual person who's going to be providing assistance does that 5-hour training and test. So it's sort of 2 steps, the organization and the individual. And then there are navigators, and navigators were people who were chosen for special funding opportunities. So that is their chief difference. In many states, they have different training requirements, but really, they're doing the same role as the CACs, plus they have a general sort of promotional mission where they're supposed to go out and find the uninsured people, whereas CACs, it's really, we're going to help who comes to us.
Okay, thanks. So if I am a Vita site and I don't have anyone trained, I could maybe find a navigator and say, come play at my site.
You could. Right? You could find a navigator. You could find a CAC. In your community, you know, they're often affiliated with, you know, maybe talk to some health centers or some other places where you know that people without coverage go for care. A lot of those places are becoming assisters of different varieties.
Okay, so I'm going to suggest now we move on to Elizabeth Colvin of Foundation Communities, and I know there are some more, I'm just going to say out loud again, I know there's some more questions, and what I want to do is hear from Elizabeth because she may answer some of them, and then we'll get back to the unanswered questions. So Elizabeth Colvin is the Insure Central Texas Director for Foundation Communities. This is a nonprofit that serves Austin, Texas, as well as a large surrounding area that includes a lot of rural counties, communities, small towns in Central Texas. So in the first 4 years after Elizabeth joined Foundation Communities, their Vita program, and she started the free tax preparation program there, grew 540% and prepared 17,000 returns in its 4th tax season. She is now leading the Insure Central Texas initiative, where she's helping uninsured residents in Texas communities find coverage at the same sites where the organization has been preparing, traditionally has always offered its tax prep services. So they're using the places that people are used to. And through this Insure Central Texas initiative, the tax prep volunteers have also been trained as certified application counselors, just as we discussed a few minutes ago. And they are working to educate families on how the health insurance works. They're also helping them shop for coverage and complete their online applications at healthcare.gov. So Elizabeth knows a lot about this already because they've been on it. So I'm going to turn it over to Elizabeth, and welcome and join us, Elizabeth.
Great, thank you very much. I'd first like to make a point that Austin is obviously an urban area, but this model can be applied to a rural setting. Now, our tax program serves people from 280 zip codes, so we have people driving from rural counties in Texas to be served. And in fact, people have come in and said, oh, my family lives out in West Texas, and when they come visit, I'm going to bring them in, because there just really aren't many services in Texas, especially in rural areas, for people to be served. So we've definitely seen the need for services in rural area, and this model can be adopted for a rural area. Just to give a little background, Foundation Communities is primarily an affordable housing organization. It came into earned income tax credit work because it realized, excuse me, that by helping families claim that earned income tax credit, that would advance families and provide a lot more financial stability than just doing rental assistance. And this chart may be intimidating for smaller organizations, but understand that all of these various financial programs have grown through trial and error over 15 years. But what was missing was help with the health insurance. And we saw in our financial coaching and our other financial programs similar issues to what Tara talked about, is that medical debt, and really without insurance, a family doesn't have financial stability. So that was one reason when we saw this opportunity to participate in the Affordable Care Act work, it really fit with our mission to help families become financially stable. So in terms of outreach and education, the activities on this slide are things we're actually doing. In October, we opened on October 1st, and we started doing weekly coffee presentations. And one of the reasons for this is because we were getting requests from all over town to come present about the Affordable Care Act. Well, basically, I'm one person, and I couldn't be everywhere to do all these presentations. So instead, we offered them at our location. We provided coffee and pastries, and invited people to come to us. And it was just a way to manage our resources, yet also educate the community. And this has worked really well. And it's helped, you know, if anybody has done presentations for Vita, sometimes you show up at a parents' meeting and there are 2 people there. And if you drove 30 minutes or an hour to get there, it really wasn't a good use of resources. So having people come to us for these education presentations, and it's 1 hour in and out, coffee, pastries, and education all together. We've also done flyer distributions through the same channels we use to distribute our flyers for tax centers. In October, we did a mailing to our 2013 tax center clients, and you're able to do that because it was an educational piece, and the IRS has special regulations about educating your clients on the Affordable Care Act. Just as we do with tax centers, we ask everyone for referrals. And our policy with tax centers is we want to be the go-to resource for the local television stations, radio, and newspaper reporters, and we've positioned ourselves that same way with the Affordable Care Act. If they're looking for Affordable Care Act stories, we want to be their go-to resource. So we make ourselves available any hour of the day, any day of the week, any time for interviews. And it's a great way to get free publicity for your program. In terms of staffing, I realize that having this many people is a luxury for many programs. So you may have someone wearing 3 hats at once, the program coordinator who's also the outreach coordinator and is also the site manager. But this is how our staffing works. I'm the program coordinator, and I'm also the trainer for all of our volunteers, and I'm also the primary spokesperson for media interviews. But I did hire a seasonal coordinator to do outreach, media, and marketing for us, and that's been very helpful. We also have a paid site manager for our locations. We currently have 3 locations, and we'll be expanding to 5 once our tax centers open in January. And then we use our volunteers as certified application counselors. And these are volunteers that we have pulled from our tax program. We are starting now to advertise to the public to recruit new volunteers, but really your best volunteers are your tax volunteers because they already have that tax knowledge, and that's so important in doing this enrollment work. And we talked a lot already about this training for certified application counselors, but I will say the fact that the Centers for Medicaid Medicare Services makes this training available, it really is easier to get your volunteers trained in this than it is for taxes, because it's a pretty interactive online training, so it's engaging, there's some quizzes throughout the way, and there's exams built into this process. So you have required modules, and then you have optional modules. But I would highly recommend that you require both the required modules and the optional modules for anyone doing enrollment work. I actually found the optional modules to be more informative than the required ones. I really think it's essential to do all of them. And the combined to do all of these online trainings and the exams is about 5 hours. And there are obviously some outlines.
Elizabeth, earlier Tara let us know that first of all your organization has to apply, correct?
Yes, well actually you can be in the process of you can apply but also have volunteers going through the training simultaneously. So it's a one-page application for an organization to apply to be a certified application counselor, and it's something you submit to the Centers on Medicaid and Medicare Services. Mm-hmm. And it's a simple application.
So, but if I'm an individual not associated with an organization, I can't just go out and become a certified application counselor. I have to be in some way affiliated with an organization that has filled out the application or is about to? Or
yeah, so you can do the online training, but to use that certified application counselor title, you need to be deemed by an organization that's been designated as a certified application counselor organization to be an official certified application counselor.
Oh, okay. So I could educate myself but not be able to use the title until I affiliate with an organization in some way as a volunteer or a staff person who is an organization that has applied.
Yeah. So that's what I'm saying. Okay. If organizations want to start on this now, they can have volunteers go through this online training now while they're waiting for their application to be processed.
And one more question specifically on this. You said where they go for the online training. It's not healthcare.gov. It's a different website?
Right, and we can, it's through CMS. It's
right.
And
so we'll, in our follow-up to everybody on the call, in our follow-up, we will make sure we send you the exact website link on that. Okay?
Yeah.
Go ahead, Elizabeth. Thanks.
So in addition to the online training, we provide supplemental training for our volunteers. And that's because the online training doesn't necessarily teach the procedures and process that we want our volunteers to follow at the enrollment centers. So it's about a 3-hour training. One of that is just a review of the ACA basics, the Affordable Care Act basics, to make sure that everyone got it in that online training. And then the remaining 2 hours are about procedures and really the two more difficult aspects, which is estimated income and trying to predict the future for 2014, and then the insurance plan selection process, how we help consumers narrow their choices, figure out what's important to them, and make a suggestion and pick a plan without us ever making any suggestions or recommendations. And then for new volunteers who are coming in and who have not been affiliated with our tax program, we also have a shadowing program, so they can shadow someone before they sit down on their own with a customer. And as Tara talked about, this is just a natural fit for Vita programs. Tax volunteers, they understand the tax terms on the application. It wants to know dependents, filing status, income, adjustments. Tax volunteers also understand what a refundable credit means and how that works. And they're used to explaining complex topics to people. And insurance, like taxes, is a complex topic. So the more I've done this work, the more I realize just it's a better fit than I ever imagined to have our tax volunteers doing enrollment work. It's also an opportunity to expand your Vita program, because we are seeing people come in with enrollment questions who pay to have their taxes done and who are eligible for our Vita services. So we've been saying, hey, in the past you paid, but next year, come January, please let us do your taxes for free. So it's an opportunity to really expand our Vita program and reach people we haven't reached in the past. And I think for a Vita program, it's really important to be able to talk to people about the benefits, this refundable premium tax credit, and talk about that now, because you're going to have to deal with this in 2015. But why wait just to talk about the penalty in 2015 when you can help people reap the benefits of the Affordable Care Act and the premium tax credit during the 2014 year?
Elizabeth, on that, I wanted to double check on this. Two things. First of all, you did say it's a refundable tax credit, correct?
Yeah, so it's advanced to you in 2014, and then it is reconciled on your 2015 tax return. So it's advanced to you based on an estimated income, and it's then reconciled on your 2015 based on your actual income for 2014. So if you are eligible for more premium tax credit that you wasn't fully advanced to in 2014, you can get that on your tax return in 2015, just like you do the earned income tax credit, even if you owe no taxes.
Okay, that's helpful. And I have one more question related to this last bullet about the penalty. Now, I think I've read, and I think I've got this right, but please verify or deny, that the longer you wait to enroll, in other words, if I decide not to buy health insurance and I'm going to pay the penalty, if I wait another year or two, my penalty goes up, correct?
Yes, the penalties go up pretty dramatically over the next 3 years. So this first year, in 2015, the penalty would be $95 for an adult, half of that for a child, or 1% of your income above the filing threshold, whichever is greater. But then in 3 years, it goes up to $695 for an adult, and then sort of the same variations for children, or 2.5% of your income. So the penalty is going to be felt a lot more in future years.
So I just bring this up because this seems to me to be very important for people who are doing tax assistance. If they, are working with a low-income taxpayer who says, well, I just can't afford health care this year, so I'm just going to pay this $95 penalty, that you be able to tell those people that, well, if you wait this year, it's going to be a heck of a lot more in all the years to come. Right?
Well, they do have the option to enroll in 2015. So just because they pay the penalty 1 year, they can enroll in future years. But I think it's also important to point out that it's not an apples-to-apples comparison of what the penalty costs versus insurance. Because with a penalty, you get nothing. When you're paying a premium, at least you're getting some amount of health care coverage, and you have protection against really astronomical medical debt if you have a catastrophic situation happen to you during the year.
Okay, thanks. Carry on.
Sure. Now, what are some of our challenges? And I obviously haven't put the biggest challenge on here, which is the website and having a working website. But I will say, having been on the website or attempting to get on the website every day since October 1st, we've seen dramatic improvements in the website, and I think anyone who's looking to get into this work now should have confidence that the website will be working by the time that you are on board. One of the concerns for our tax program was they want to make sure they have enough volunteers. And in our program, we never feel like we have enough volunteers. But when you look at what's going to be a slow time and what's going to be a busy time, the programs really work well together. So for our program, we're expecting the Affordable Care Act work to be really busy in early January. There's going to be a lot of news stories. Insurance will start. The website will be working. We expect to have a huge influx of people in early January. The tax centers really don't get busy until the very end of January, January 28th, 29th, 30th, when people are getting their W-2s. And then you have that rush the first week of February, and it sort of extends through Valentine's Day. But since the enrollment period goes through March 31st, we think we're going to have slower enrollment in February. Just like with taxes, for procrastinators, they're going to wait. So we expect the enrollment work to pick up as the tax work is slowing down. So we expect March, which is normally pretty dead for tax centers, to be super busy with enrollment because of that March 31st deadline. And then we'll be done with enrollment March 31st, and people can focus, the volunteers can focus on taxes April 1st through April 15th. So I think the way the timing works this year is a really great fit to have volunteers doing both throughout the tax season. Another one of the challenges is those of you doing IRS work, you know about the IRS publication 4012. This sort of has all the answers in it. It's all these great trees that you can go through, these decision trees. And we don't have that in this enrollment work, but we have fabulous resources like Tara, who I talk to practically daily with questions. And, and the Center on Budget and Policy Priorities is rapidly developing tools to help people doing enrollment work. There are also other organizations that have developed some really helpful tools doing enrollment work. The two most challenging areas, as I mentioned before, are estimating income for 2014, because no one has a perfect crystal ball, and the past is not necessarily a predictor of the future, but we do the best we can in estimating income. And then evaluating insurance plans. I know there have been some questions and concerns about that, but we've developed some tools to help our volunteers, help people figure out what's important to them and narrow the choices. And in doing this work since October 1st, we've learned that the process is important. In the beginning, we had people just jumping on the computer to start with the application, and we realized several steps need to happen before you ever get on the computer. And I'm happy to sort of share what we learned through our mistakes with the field, so you don't have to go through what we've gone through in October. So we've created this enrollment process for our volunteers, and it's called Enroll with Glee. And so we have our volunteers go through these steps now, and they don't get on the computer until step 5. So there's a lot of listening, educating, and estimating, and that will help the application process go so much smoother once you do start the application. And then the last step is evaluating the insurance plans. So that is my presentation. I'm open for questions.
Well, we have quite a few questions, and Tara, you should stand by too, because there are some of these that you may be suited to answer as well. We have, let's see, there's a wide range of them. So let me start with, can the same person become a navigator and a certified application counselor?
Well, a navigator means you received a federal grant, and those were issued back in August. So you either got that federal grant and are a navigator, or you didn't. And there's no reason to do both. Okay, that takes care of that. There are some questions on the health insurance stuff itself. There was a question from Sandra Starnes a while back saying, does it mean that no matter how good a plan you choose, you still pay the same amount?
No. So as I said, and we didn't really have time to go into a lot about how the premium tax credit is calculated, but there is a benchmark amount, which is a plan that's not the best plan out there, but it's not the worst plan either. It's kind of a plan in the middle that the government says, okay, we're going to help you get this plan. If you want a better plan than that, you're going to have to pay the extra money for the better plan. So it's not, you're not going to be paying exactly the same no matter what plan you choose, but you'll at least be able to get a decent plan with government help. And if you want additional, if you want a really, really super excellent plan, then you're going to have to pay. You're going to have to pay a little bit more out of pocket.
And another question on the health insurance itself: will doctors be allowed to decline certain insurances that pay less?
Sure. Just like they've always been able to do. I mean, the health insurance companies establish their network and decide, what rates they're going to pay and have providers sign up just like, every other private insurance out there. Okay.
Let's see. Many non-custodial non-custodial parents, I think, claim children every other year. So how is that going to work?
Well, then a different parent would be responsible for their insurance for every other year. Unfortunately, that's how it would work. So let's say the custodial parent is claiming the exemption for the child in 2014. The non-custodial parent is claiming the exemption in 2015. The availability of the premium tax credit is always going to travel with who is claiming the exemption. So in my example, in 2014, the custodial parent would claim the exemption and would be eligible to get premium tax credit on that child's behalf. But in the next year, when the other parent was claiming the exemption, they would be eligible for a tax credit on the child's behalf. Of course, the child could stay in the same plan if that's what they choose to do. But the person who claims it on their taxes has to be the person who is claiming the dependent.
Okay, I'm trying to think, how would the child stay on the same plan if the parents have different plans?
Well, the child could be in their own plan.
Okay. All right.
So the insurance can be selected individually, and so you might say, okay, my child's going to be in Blue Cross ABC, and either both parents could select Blue Cross ABC in each year.
Okay, so I mean that seems a little different because usually the children is attached to the parents' policies, but you're saying you can have actually a different policy for a child.
You could if you wanted to.
Okay.
I mean, or the child could change insurance policies every year. It doesn't. I mean, it's entirely up to the parents and what they do for their own convenience.
Mm-hmm. And just to I think this has already been answered, but just in case it wasn't, or if this person missed it, Kay Pearson asked, the credit works to reduce the amount paid by the insured on a monthly basis, question mark?
Yes. So yes. The premium tax credit is advanced directly to the insurance company on a monthly basis on your behalf based on the information you've given them through the application process.
Okay. Let's see, how long does it take for an organization to become a certified counselor? So let's say you put the application in. How long does it take for that application to be approved, for the organization to be approved?
I think it's hard to estimate. I don't know what the backlog is, but I would expect a few weeks.
Mm-hmm. A few weeks. And what about how long does it take the training process that you put up that people can get at CMS Marketplace? I believe the website, by the way, is marketplace.cms.gov. At least someone texted that's what it is to us.
I can give you a more specific link.
Okay.
It's a little hard to get to from there.
Yeah. Okay, so we'll get everyone a more specific one than that, but thank you, Barb Wolin, for putting that up. How long does it take then, the training process? How long would it take, if I wanted to start training today, how long would it be before I could, what's the sort of shortest amount of time it would take me to become a certified application counselor?
Well, we tell someone 5 hours, to estimate 5 hours for the online training.
Mm-hmm. Is that for both the mandatory and the optional?
Yes.
Okay. All right, well that seems very doable, but you don't have to do it all at one sitting, correct?
No, you do need to finish the modules in one sitting, because if you stop sort of mid-module, you'll have to repeat it. But there are multiple modules, so as long as you complete a module, you can stop, take a break, come back on another day. It works fine.
Mm-hmm. And Joyce Lash, who sent a lot of comments, mentioned, and I think it's worth saying this out loud, that the premium tax credit, the tax credit on the health insurance premium, is you can only receive it if you're enrolling in a policy available through the marketplace. You can't, for example, receive it if you're paying a portion of your employer-provided health insurance, correct?
True, yes.
All right, so that's important. In order to get this tax credit, you have to enroll through the marketplace. Okay. Sandra Starnes has a follow-up on the child question. So does it mean that the child can go on and off Medicaid based on the parent's income? So if one parent's on Medicaid and the other one isn't, would the child go on and off Medicaid between years?
Not necessarily. The Medicaid rules. The Medicaid rules are different in some cases. So of course it depends on the situation, but there it's usually based on the custodial parent.
Mm-hmm. Okay, I want to encourage others. I've only got, I think, one question left. If you have any questions, go ahead and send them in the question box. I like Barb Wolin offered a comment about farmers, which is, of course, a rural constituency of taxpayers, saying some people, like farmers, for example, although there could be others like this, may choose not to get the advance premium payment. And they want to wait and just get it on their tax return refundable, especially if their income is unpredictable. So farmers often don't know how their crops will be in 2014, so they would rather wait and get it later. So that's something to keep in mind, especially with people who have unpredictable incomes. Also, we had a comment that we should, and I'll let you guys respond to this, we should be cautious in stating that more expensive plans are better. Bronze is a great choice for some people. Platinum is not necessarily the best choice for a healthy young individual. You might spend more on premiums that are necessary. Do you have any comments on that?
That's definitely true. I mean, it's a very individual choice based on, how you feel about, how high can your deductible be? Is your most important thing the having a specific doctor in your network, like someone who has cancer, for instance, might really want a particular doctor in their network to continue a course of treatment they've started. So there are lots of individual factors, and so yes, definitely it's true that not everyone is looking for the same policy.
Well, that's why I think. Oh, go ahead, Elizabeth.
Yeah, I would also say that we tell people not to get fixated on the metal levels, because at least for our area, they're sort of mixed in. The platinum plan is actually less expensive than some of the gold plans. There's some silver plans that are less expensive than some of the bronze. So we tell people not to fixate and just look at a particular metal level, because they may be missing out on a better plan for a lower cost. So,
right,
and as Kara said, it is very much an individual decision. And we're asked every single day, I'm doing enrollment, so what is your plan? What's the most popular plan? And we just turn it back on the person. It really doesn't matter. It's important for you to pick a plan that meets your needs. And
that's what I was going to say, Elizabeth. When you talked about your GLEE process, you said greet, listen, and it's that listening piece. What's important to them in a plan that you're really saying is something that you need anyone who's helping them to do.
Yes, because every situation is different. everyone's on different medications, they have different doctors, they go to the doctor a different amount of times. So it's really a very individualized process in picking insurance.
In listening to all of this over the past months, I couldn't help but think of however many years ago it was, maybe one of you knows the exact years, it wasn't that long ago, when Medicare Part D passed, and seniors had to sort of like enroll in a plan for their prescription coverage. And I sat down with my mom, and there was a website problem then too. Some of us remember who sat down with our moms or our dads to do this, or with friends or neighbors. And it was, there were lots of things to look at. It wasn't just what's the cheapest. It's what covers my mother's formulary, the prescriptions that she takes, and what are the premiums and this, that, and the other. So there are lots of things to pay attention to there. The parallel seems clear for me on that end anyway. We have a few more questions here that have arrived. The penalty applies to adults at what age, Kay Pearson wants to know? 18, 21? What age does the penalty apply to you as a taxpayer?
It is 18, I believe, 18 or 19. So I think it goes with the definition of the age for a qualifying child. I'm pretty sure it's linked to that. But it's 18 or 19. I don't remember if it's 18 or if it's below 19, like how they frame it in IRS terms. But it's definitely one or the other.
We'll get that clarified and make sure people we'll send that out in our follow-up email. Okay. Question from Lourdes Ortega: if an employer is providing insurance, but the share of cost is too high, can the individual switch? In other words, leave the employer's insurance and go into the marketplace to purchase their own insurance individually?
Yes, we didn't have time to get into that, but if the employer's insurance costs more than 9.5% of your family income for your individual, the worker-only policy, then that's considered unaffordable, and someone can decide to leave the employer option and go into the marketplace with the help of premium tax credits. But there's a little trick there. Because first of all, you're looking at the cost of the insurance just for the employee, not for their family, but just for the employee, and you're comparing it to family income. So that might include any spouse's income. So if the cost of your individual employee-only policy is more than 9.5% of your family income, then that's considered unaffordable.
If your contribution cost is more than 9.5%.
Your contribution cost, yes.
Okay. Thank you. Does the application cover the situation where a custodial parent qualifies for Medicaid for children, but the non-custodial claims the tax exemption? We may have answered that already, did we not?
I think we did.
Okay. I think that's another thing that we'll try to get clarified in the follow-up. We'll maybe try to put together a frequently asked question that address the questions, and we'll put those up on the website once we get this up. Is there any tax benefit from the Affordable Care Act for employees who take advantage of a Vita site, receive the EITC, and pay a premium towards their employer health insurance? Oh, towards their employer health insurance. I think we just answered that one as well. Mm-hmm. You can't apply it to your contribution to your employer health insurance except under that sort of percentage provision that Tara just explained to us a minute ago.
Right, and the theory there is that if you're getting employer-sponsored health insurance, then usually you're, usually the employer is contributing, but also remember that's pre-tax money. And so it's a pre-tax contribution. So you're already getting some tax benefit. So people might think it's so unfair that people without insurance are getting assistance, and I'm not because I'm in my employer's plan. But remember, you're already getting pre-tax help, so you're already getting a kind of tax assistance. We just haven't looked at it that way traditionally.
And Barb Woolen, who's being so helpful, thank you, Barb, says point out that if the spouse has employer insurance, then the other spouse can't get the premium tax credit. Is that correct?
That's true if the spouse has insurance, if the spouse's employer offers family coverage. So if,
Okay.
if the spouse, so basically that would mean that the other spouse has an offer of coverage because of their spouse's employer offering family coverage. If the employer, however, doesn't have a family plan, which is true for some employers, especially in low-wage jobs, they might only offer employee coverage and not family coverage, then the other spouse would be free to get premium tax credits if they're otherwise eligible.
Okay. James McKinster wants to know, was the Medicaid expansion implemented to primarily help cover low-income, single, childless, or dependenceless adults?
Well, it was implemented really to help kind of many kinds of adults, but in all states, coverage for children is higher than coverage for adults, which many of us would expect. But you have some people who could be earning $0 in a year and who could be homeless and really have nothing but still not be eligible for free care in some states and through Medicaid. And so it was really a decision that premium tax credits only help you at a certain point. And so for people who have very, very low incomes, we got to just raise the bar on Medicaid because they're not going to be able to really use any kind of premium tax credit.
Mm-hmm. So Ruth Milhalab sort of poses this question, which we may have answered earlier, but let's just make sure we're answering it to get it clarified. As a Vita volunteer, we should not be discussing plan details, just what they need for the application and credit as far as income and filing status, etc. Is this correct?
I don't, no. So what I would say, and I'm sorry if it was unclear, is of course we're not encouraging anyone to just sort of go out there uninformed and give people all sorts of advice if they don't feel comfortable doing it, right? So I would say as a Vita volunteer, if I maybe if I did some training, like if I did the CAC training, even if I can't hang my shingle as a CAC because I'm not affiliated with an organization, but I still feel comfortable with what I've learned, then I would feel comfortable saying, take that client through the process as far as they want to go, right, till the very end, as long as you feel comfortable with what you're doing, obviously. But at very least, I think you really will feel comfortable with the material that's the financial material on the application because it is so much what people already do and know and are expert in. And so if you feel like you can help with the plan selection process, then go for it. And helping people understand, well, this is what a premium means versus this is what a deductible is. I think that's very valuable assistance.
Elizabeth, do you have a perspective on that?
Yes, people really need help with this plan selection. I think it's overwhelming. And for people who haven't had insurance, these are completely foreign terms. How does the deductible work? How does the premium work? So it's a really valuable service to be able to tell people how these plans work, because a number of them may not pay anything except on the preventative care until they reach the deductible. So it's a valuable service to help people understand what that means so they know what they're buying if they select that plan. So I would really encourage people to go through the training so you can help people with this insurance plan selection process.
So let me transition here to two things. First of all, I know there are some special tools that the center is about to be putting out, and I want Tara to talk about those, and Elizabeth also to mention anything they have available that people could look at, even if it's some of the material they're using for outreach. But before that, I want to mention that we are willing here at the Rufus Action Network, if there's a group of people that really want to start advising each other, we are willing to put together a little peer learning group and get you on the phone with each other to sort of pose questions to each other if you're going to get serious about this. So Travis is going to put up another little poll, and you can answer this while we're closing out here, and just sort of let us know, and we'll figure out who you are and start getting you together as needed through this tax season. Now, I wanted to ask Tara, my understanding is that you're going to have some assistance available tools. Can you just talk to us about what you're going to have available and what the timeline is so that people here will know when and where to go?
Sure. Well, we have been conducting a series of training sessions for not just for tax people, but for anyone who is involved in enrollment. And stemming from that, we're going to be starting, we're going to be producing a series of tools that are especially for Vita sites or for low-income tax sites to help people engage and really leverage the expertise they already have to help fulfill some of these enrollment assistance needs. Because, you know, we have sort of joked and whined about the fact that the website hasn't worked so well up until now. But what that really means is that there is going to be even more call for people who will need help in especially in January through March, because we had hoped that more people would be enrolled by now. But instead, we're going to have a lot of people who are you know, delaying enrolling, and so they're going to really need some help, and we're going to have some bottlenecks. And so we're producing some materials to help folks understand the law, to help you train volunteers, slide decks and presentations to help you train volunteers in, you know, one, the very basic questions that they might be asked regardless of whether you do any kind of enrollment assistance. People still might have some basic questions that your volunteers would like to provide some informed answers on. But also, you know, our hope is that sites will really want to engage in a more serious way. And if that's the case, you know, we're selecting a number of tax sites where we really hope to provide some specialized assistance to you, including the training, but also really kind of an on-call service as you encounter, you know, problems with individual clients and questions clients have, needs for materials and all of that. So we're looking for some sites that might want to receive some technical assistance of that nature, because we have a little bit of funding to do that. So so we're hoping that we can find some sites that want to really get engaged, and then we can hopefully, you know, learn some things. So next year, when everyone has to have some level of really competence in the healthcare law, because we'll be reconciling these tax credits and assessing penalties, that we'll be able to have learned some lessons from this year and help people apply them next year.
And so, Tara, if I was gung-ho and I wanted to be part of this little TA group that you're talking about, how would I let you know that?
You can email me. My email was on the slides, or certainly going through Travis. You can get my contact information, and we're happy to help you figure out if this is if this is something that you are, you know, able to undertake.
Okay, great. And Elizabeth, is there anything specific that you've got that people can access through your website or another way that you think would be really helpful to them?
I'm happy to share the tools that we've developed, and I can send those to Travis for distribution. That's probably the best way to get that information out. We have an information sheet that we use as a guide for our volunteers when they're educating people about the Affordable Care Act. And we also have a list of questions on insurance plan selection to help people figure out what's important to them in selecting an insurance plan. And I think those will be helpful tools for the field.
Mm-hmm. So I just want to close out then and mention that there are a couple other. Kevin Byrne asked again about the 9.5% of household income. Kevin, we'll get that clarified in the email that we send out afterwards, or on the website. And as I said, we'll put together some frequently asked questions. And Kathy McIntosh just emailed, is CPE credit available for today's webinar? I'm not sure, but it sure should be. We should all get credit for today's webinar, because I've learned a lot. And I really want to thank especially Elizabeth Colvin of Foundation Communities and Tara Straw of the Center on Budget and Policy Priorities. The Center has been so gracious over the years in helping us with what has sort of become an annual Rufus Refresher webinar. And that and also really Elizabeth is representative of a lot of people in the field who are doing programs on the ground who join us annually. We have 2 or 3 every year to talk about something new or innovative they're doing to really help rural families tap the EITC and CTC resources, and now, in this case, we're beginning to tap the Affordable Care Act resources for hardworking, low-income rural families. I also want to thank my colleague, Travis Green, who worked really hard to put this all together, and give him all the kudos he deserves. And thank you all. We look forward to the next webinar, and we'll be, Travis has up on the screen anything you can do. If you have more questions, you can email them to us at csg@aspidence.org, and we will be mailing out the audio of this, or the sort of video, whatever it is, you know, the webinar recording, as well as letting you know what else you can find on rufus.org. Thanks to all of you, network, and we look forward to the next time. Take care.